मैं ये थोड़े से लोग ज्वाइन कर I welcome you all. Bismillahirrahmanirrahim. I welcome you all to the fifth talk on artificial intelligence series at Pakistan Academy of Science. Today our speaker is Dr. Farhan, Head Artificial Intelligence Program, GIK Institute, TOPI KPK. Dr. Farhan has done his PhD in electrical and electronic engineering from University of Ankara. His research focus are machine learning, signal processing, and deep learning. After his PhD, he joined SUTD University Singapore as a postdoc fellow and data scientist for Keysight over there. Dr. Khan has more than 10 years academic and research experience working in different national and international organizations. His research interests are in the areas of artificial intelligence for health and industrial informatics, wireless communication, signal processing, and privacy preserving machine learning. Currently, he is working as head artificial intelligence program at Ghulam Ishaq Khan Institute at Topi Sawabi KPK. In today's talk, he will have discussion on artificial intelligence in healthcare, COVID-19 response, and cancer prognosis. So I welcome Dr. Farhan Khan for this talk to Pakistan Academy of Sciences. So please, sir, over to you. You may start now. Thank you.
Hello everyone and good afternoon. Thank you very much Dr. Khatak for giving such a nice introduction, and I also would like to thank Pakistan Academy of Sciences for giving me this opportunity. Since my area of interest is artificial intelligence and looking at its different applications in different industries and walks of life, so today I'm going to cover the artificial intelligence applications in healthcare. Nowadays, it's very relevant, especially in the time of this pandemic, and otherwise the people's health is of utmost importance. It's one of the SDGs of UN as well. So before further ado, let me start this lecture. Today I'll start with a brief introduction of what AI is and discuss some major applications of AI in healthcare. There are as many applications as we can count, but some major applications that we would cover today are disease diagnostics, then primary care or triage, robotic surgeries, elderly care through monitoring and prompt action, virtual nursing assistants, and disease prognostics. Then after that, I'll briefly discuss about and talk about the threats and risks of using artificial intelligence in healthcare, some challenges and some possible solutions for them. Finally, I would like to conclude my talk with some brief concluding remarks. So let me first start by defining what is AI. Probably most of our audience already know that, but just for the sake of continuity, let me reiterate. Artificial intelligence, according to Britannica, is the ability of a digital computer or a computer-controlled robot to perform tasks commonly associated with intelligent beings, for example, human beings or chimpanzees. IBM regard artificial intelligence as something that use computers or machines to solve problems and make decisions just like human mind. So it's like mimicking the intelligent behavior of humans by machines. So it's artificial intelligence usually involves machine learning, which is the process of using the environment, learning from the environment, and through that, through some processing on the data that it retrieves from the environment, make some intelligent decisions. It also involves deep learning, which is a more recent area of research, and it actually revolutionized typical applications of AI that we normally see, for example, in search engines, market analysis, and so on. AI in healthcare is of utmost importance because it involves, deals with the human health. So the first application that we usually, and the most sought after application of AI in healthcare is diagnostics. So where normally deep learning is used to detect a disease through CT or X-rays or other imaging data. It is also used to detect tumors, to locate tumors correctly, and to see the nature of the tumor. Another interesting application of AI in healthcare is resource management. For example, it could be used for intelligent and adaptive usage of hospital facilities, medicine distribution, which is usually learned through the data-driven modeling. Then artificial intelligence could also be used for predictive health monitoring. Once somebody is diagnosed with a disease, what would happen after that? Artificial intelligence could help in there, how the patient is taken care of. One of the example is staging or grouping of patients based on their risks. And we could also see the trend of a disease or the trend of spread of a disease in general population through the use of artificial intelligence. So let's start with the diagnostics. AI helps in early and accurate diagnosis of diseases. For example, if we didn't use AI, an accurate diagnosis of a disease could take time, which could be very costly. In AI diagnosis, usually we use imaging data, for example, a patient X-ray, and we could have a deferral module, which would defer the patient's report to an expert radiologist or to a machine learning classifier instead, where it would detect whether there is a certain disease or at what stage the disease is. Probably this model could also couple other medical records that is available for the patients with this X-ray information. In that, we can build an intelligent decision support system where AI can support the clinicians in making early, accurate, and precise decision about a patient. It increases the productivity. For example, an AI-based decision support system could examine 100 patients in a couple of minutes. That would take hours or days by the health professionals. Time is usually very important, particularly in cases of acute and life-threatening nature. We have a model of intelligent decision support system where we employ natural language processing to collect data by taking history from the patients and producing some clinical notes, probably in the language that is used by the physicians, and that language could then be turned into features stored in a database called EMR. And then machine learning model could be used to work on their data to produce useful results. And once the results are produced, they could again be turned into a language that is understood by the humans to make certain tasks. The system of natural language processing makes it more convenient for doctors to narrow down all relevant information from patients' reports. And it also generates human readable reports. Here is another model where a decision-making tool is using the patient's primary data, his or her secondary data, and the knowledge bases that is already with the system to make a timely and intelligent decision. Another second application that we are going to cover today of artificial intelligence in healthcare is the use of primary care or triage through chatbots. Normally, we see that people have a tendency of booking appointments and visiting their doctors at the slightest threat or medical issue, which could often turn out to be a false alarm or probably something which could be easily solved with self-treatment, probably by taking some over-the-counter medicine or something like that. So to reduce such kind of visits, we could use artificial intelligence instead, where there is a chatbot that could chat up with the prospective patients, take his or her symptoms, and probably if there is no further treatment or required and it's a simple issue, the chatbot can then diagnose and prescribe some over-the-counter medicines. Or if there is an issue, then the chatbot can recommend the patient to the relevant doctor. With that, we can avoid human connection and reduce the risk of contagious diseases as well, like flu or COVID-19, etc., which is very relevant in today's world. This is how an AI chatbot would work normally. It takes the input from a user, a human user. It analyzes the user's request, probably through parsing and using natural language processing, identifying relevant features, and then based on that, compose a reply and give it to the user. It normally uses NLP, natural language processing, coupled with deep learning. The third application that we are going to cover today is about robotic surgeries, which is of very delicate nature. AI and collaborator robots can do that, where robots can make delicate incisions without fatigue. They can work 24 hours, and AI machines are capable of employing data from past operations to develop new surgical methods as well. The precision of these machines reduces the possibility of tremors or any unintended or accidental movements during the surgeries. Another application that we are going to cover today is to check the disease risk and mortality analysis. This is especially relevant in the era of pandemic. We could use an AI-enabled model to predict how much a disease would spread in a certain population, and probably explain it, interpret it, and also once a sample of population who get the disease, what would be their mortality analysis, what is the survival rate, and so on. These kind of things are used ubiquitously since the pandemic started, and this is how we are actually winning the war against the COVID-19. So in that, it's again an intelligent decision support system, which is a data-driven smart decision support system that provides ways to inhibit morbidity rate, the chances of catching a disease in target population. It helps improve survival rates of patients category-wise. It should be able to provide mechanism for prevention of infectious diseases to high risk and general population. For example, the people of older age. And it would also help clinicians and policymakers for devising effective strategies, probably by deciding to hold a lockdown, a smart lockdown, making the masks mandatory, and so on. Before going into details of this disease risk prevention and mortality analysis, let's first define a few key terms. Morbidity rate is which usually used by the epidemiologist, which is the risk of getting a certain disease by general population or some high risk groups. It is defined as the number of people that gets the disease divided by the total the size of population, where the patients or is usually a subset of the population. So this would always be a number between 0 and 1. And we would like to this number to be as close to 0 as possible. It can be inhibited by preventive measures such as limiting mobility, contact with patients, wearing masks, improving hygiene, etc. Another key term that we use normally is survival rate. That is, once there are patients, once there is a part of population who gets the disease, what is the next stage? How what would be their chances of survival? It is normally calculated as the difference between the population and the people that gets the disease divided by the total number of, sorry, not get disease, the people who who died with the disease. So N is the total number of patients, ND is the number of patients who died due to a disease at time t, and P is the set of patients which is subset of the population who gets the disease. Um, a better term for for survival rate would be to use a progressive survival rate, which incorporates the time varying nature of the spread of a disease. So in here we instead of fixing the value of n, now it's time bound. So it's, for example, NT is the total number of patients till time t, and DT is the number of patients who died till time t, and BT is the set of patients at time t. Here are some graphs that shows the survival rates, both for standard ones and the progressive ones for different risk groups. For example, for a low risk group, with time, the chances of survival are decreasing at a slow rate, while for high risk group, the chances of survival are decreasing at a high rate. So it's very important that we group the patients into as per their risk groups, so that the respective measures could be taken. It helps the study of progressive survival analysis according to the patients and the spread of a disease, helps to make an intelligent decision support system which uses clustering to keep the patients in their respective risk groups, and then we can work on each group individually by using some preventive measures or treatments that would decrease their mortality or increase their chances of survival. These measures may include medicinal therapy, oxygen therapy, and the data that is normally used to group these patients is their demographics, the vital signs, their oxygen saturation levels, their preclinical history, and probably age. Another way to improve the survival rate is to use preventive measures. For example, we can learn about preventive measures that, from the progressive survival rates graphs, and like we can learn what preventive measures would increase the chances of survival. So those preventive measures could include masks, inhibiting physical contact, use of PPE, and vaccination. And this is one example of an intelligent decision support system where the clinical data of patients is used, or their demographic data is used, integrated, and then a deep neural network is used to make to predict the risk or survival rate of different patients. There is another example where I used the prognostic system for a well-differentiated thyroid cancer using AI. It's an adaptive hierarchical tree-based clustering method where the patient's data is used to identify features, and then based on those features, the patients are clustered in different groups, and survival rate are drawn for each groups individually. In this experiment, we used cancer patients data set, which was obtained from seed. which is program of National Cancer Institute of US. The features that are available in the dataset include tumor size, regional lymph nodes, the status of distant metastasis, and age. In this, we initially form some clusters with a certain depth of tree, and then we use a clustering method which is called partitioning around midwives. And this algorithm is initialized with some initial midwives and random number of clusters, and then we try to increase the number of clusters till we reach a saturation or point. So far we discussed some applications of AI in healthcare. Now, a very important point of using AI in healthcare is to take care of the risks and challenges in doing so. So there are multiple risks and challenges in using AI for healthcare. For example, there are privacy concerns, there might be errors, and which may result in injuries. There a very important issue is of also the data availability. So let's discuss a few of them one by one. So we'll start with injuries and errors. One very common problem in using AI in healthcare is the false alarm, where a healthy person is falsely diagnosed, for example, with cancer, and he or she may receive chemotherapy, which could turn out to be a poison for him or her. Another problem is misdiagnosis, where a cancer patient may be declared healthy, increasing his or her health risks and delaying his or her treatment. It could also result in error in locating a tumor in radiology, which could have dire health-related consequences. While human error could potentially risk a few patients, because that's very well known that even doctors and very professional and experienced surgeons could make errors, but it would risk probably very few patients. But however, AI errors could lead to injuries for thousands of patients. Another very important concern about using AI in healthcare is the availability of data. AI system absorbs and learns through the data with which they are trained, and they are as good as the data they are given to. So training these systems require massive amounts of data from multiple sources. These sources include pharmacy, electronic health records, insurance claims, etc. And it gets complicated and less comprehensible, as a result of which the risk of error and the cost of data collection escalates. Bad or incomplete data results in making incorrect decisions. There are some solutions, though, to data availability issues. For example, usually the data, if we collect, as humans, we normally collect data by asking questions or by talking, but machines don't understand human languages. So we could use NLP for speech synthesis and get valuable information features from patients describing their symptoms, and which is language and context dependent. So here is a model where we use Urdu speech for probably a patient is describing his or her problems to the doctor. It could be converted to text, and from that NLP would extract some valuable features, and based on that features, some machine learning model would be used to make an intelligent and timely decision. Another important issue of using AI in healthcare is privacy concerns. The collection of huge data sets and the exchange of data between health systems and AI developers to enable AI system leads to violate patients' privacy. It has the capability of predicting private information about patients, even if the patient has not given that information. So probably patients didn't want to declare such information. For instance, a patient might not want to share some health issues due to concerns of losing his or her job. Some solutions for that could be anonymizations of patients' data, for which we use privacy-preserving machine learning. Humans don't get to access actual data, but the corresponding encrypted data that they can feed to the machines. Another issue with using AI in healthcare is bias and inequality. AI systems, as we mentioned before, are as good as the data they are trained on. And they have a heavy dependence on human expertise as well, which may be a bit biased. For example, if the data incorporated in AI is mainly collected in academic medical centers, then the developed AI systems will have less awareness about, and as a result will treat less effectively patients from populations that do not typically frequent academic medical centers. So to ensure no bias or less bias and produce more robust results, we should focus more on getting better models. So probably more training, using more complex model, so that the model is not underfitted or overfitted, and they make optimal decisions. For that, we usually use sampling of data that is unbiased, independent, and cross-validation techniques, which gives us the best parameters of the model. They are in this middle region. A very long-standing concern about AI system is that it would lead to joblessness or reduce job opportunities for health professionals. It's a very common misconception or myth about AI in almost all fields that are known to humans and that were historically used in the world, particularly in the areas like radiology and pathology, where most of the work gets automated through AI. Also, there is a high degree of employment of AI, which might lead to a fall in human knowledge and capacity over the years. And it would make providers fail in detecting AI errors as well as in the further development of medical knowledge. So probably we won't want to use an AI which is not monitored or not controlled by humans. As it is a threat, but possibly it's a misconception. As in the words of Larry Page, the co-founder of Google and Alphabet, artificial intelligence is the ultimate version of Google, which would understand ultimately exactly what we wanted. It could predict whatever we are thinking, but there is a long way to go there. We are very far from that point right now. So in conclusion, what is AI? Is it good or bad? It is as good as or as bad as its human handlers. For example, scientists and engineers develop guns, but guns don't kill people. People kills people. Another example is of nuclear power. It can be either used to provide sustainable and eco-friendly energy for the generations to come, or it can be used to wipe out populations. So AI is as good as much good as we want it to be. Here is a bad example of AI in healthcare. For example, a badly designed or developed AI chatbot, which would turn everything literally without context, could give wrong solutions. Current state of the art in AI, there are lots of different companies which use AI for different healthcare solutions. For example, Wiz.ai is helping care teams react faster with AI-powered healthcare solutions to reach to populations where healthcare professional services are required. Another one is Path AI, which uses machine learning technology to assist pathologists in making more accurate diagnosis. Freenome is used for earlier cancer detection with AI. Another one is Box Cell Therapeutics, which uses AI to identify and develop new medicines in the field of immuno-oncology and neuroscience. A very important player is Google Health, which is working on several applications of AI in healthcare. So finally, we have arrived at the summary of this talk. It's about an AI decision support system which provides improved survival rate for patients. It increases productivity and accuracy in diagnosis, reduces burden on hospitals and healthcare professionals. Patients on population clustering are done according to the risk groups. It works in preventive care. It inhibits morbidity. It could be used for as a dynamic and adaptive resource allocation for example, clinicians and medicines or hospital beds. It could be used for vaccine administration, priority lists, and groups. So this is what my talk was all about. I hope it was um, uh, it was okay. And if there are any questions, I would be happy to have them right now. Thank you very much.
Thank you so much, Dr. Farhan, for such a nice talk. Now I would request the audience, if you have any question, you may please ask.
Yes, please.
Audience both online as well as present at Pakistan Academy of Science. Dr. Farhan, I have a small question related to the research work uh, that you have done so far, where we actually apply it in the recent infrastructure instead of going for deployment of some specialized infrastructure. Can we deploy it in the existing one?
Sorry, Dr. Khatak, I didn't get your question from the beginning.
The question
Which
is that the research work you have done so far, is it applicable in the existing infrastructure? We would need some specialized hardware or software for this purpose.
Okay, so the purpose actually to integrate it into the existing infrastructure, but there are some loopholes. For example, when I talk to some clinicians in Pakistan, their main concern is that it's very hard for them to get the data consolidated and collected. So probably, which is usually in computer science terms, we call it an IO bottleneck. So that's why probably a system with speech synthesis and NLP would help there, so once we have the data in a consolidated and for example, in a structured format, it's very easy from there. But to get to that point is usually our issue. So this is one of the issue that I'm and my team is currently working on, together with some doctors from the health industry. And another one that I briefly discussed about was about the cancer prognostic system. So that is something that we already have, but my work is to make it better. So for example, the current system that we use have some certain limitations. There is the data size is quite huge, and the time it takes to make these clusters is quite long, because the data is of categorical nature, and so the algorithm for clustering that we use is using medoids, which is as you know, it's of the order of n square in complexity. So there we are trying to reduce that complexity to the logarithmic scale by providing new algorithms. So I hope I answered your question.
Yes, sir. Yes, sir. Thank you so much for answering my query. Is there any question from the audience? Ibrar Saab? Anyone else would like to ask a question? So you are free to ask. So if there is no question, I would like to thank all the participants, and also Dr. Farhan Khan for such a nice talk. And I will request the concern in Pakistan Academy of Sciences, if is it possible that we can issue some digital certificates to these participants, that will be good enough. Digital certificate. It will definitely encourage them that they should properly contribute as well as participate in such activities.
Surely, that's a very good suggestion. We'll certainly talk to the Secretary General, Pakistan Academy of Sciences, and try to issue the certificates as you suggested.
Yeah, exactly. That will be good enough. And I personally also attended many seminars in Comstek, and they shared the digital certificate with every participant. And I think so that it's not be a matter of any complexity. So we can easily do that. We can also design a certificate and then onward get the sign from Secretary General and President and share it with every participant. We just need the email addresses of all those participants so we can share it with you as well as with the speaker.
Surely, Dr. Sir, we will follow this practice.
Yeah.
Thank you.
So thank you so much again to all participants and Dr. Farhan for such a nice talk. And we will hopefully engage you in future as well. So looking forward for more healthy collaboration with you and GIK. So thank you.
Thank you very much, Dr. Khatak, and all the other participants and Pakistan Academy of Sciences. Also, I put my email address at the end of this presentation. So if somebody, probably they don't have any questions right now, but if in future, if there is any questions or somebody wants to talk about something, I'm always available, and I'll be looking forward, and we could have a collaboration and further discussion on the areas of artificial intelligence. Thank you very much.
Right. Thank you so much. Thank you. God bless you all. Thank you. Allah Hafiz.